One of the charts that our staff put together that was really helpful for me shows the medical assistance budget. I'm sure you can't see it from there, but it's a total of $18.7 billion for medical assistance. And they're showing on the chart that 69.1% of this entire pie is really consumed by medical assistance. So that's the total $18.7 billion, but it's 69% of your total budget, as you well know. Can you tell us what steps the department is taking to look for savings in that medical assistance area?
Well, other than we have several provisions within the budget. The GA provisions will save significant money on the medical assistance population. Actually, off the top of my head, I just lost track of some of the other MA provisions that we have in there, but we can get you a list on the entire MA provision.
Okay, well,
excuse me, Representative.
Sure.
In this current budget, we have reductions to hospitals. We have reductions to nursing homes. We have a provision in there for high-cost case review to review our highest-cost cases. We have the MA provision on newborns, and I'm trying to just off the top of my head, but it's very little from the perspective of, and we can get you the list that's in the current budget proposal, but that's a big or a large number of them. But I think it's, as I had alluded to earlier, we have very little room to work on that 80% because of the maintenance of effort requirement that the new federal health law imposes on states. So we're basically left with cutting rates to providers, and we can't even look at, so for example, we can't even look at changing levels of care for long-term care because they may see it as a loss of eligibility. So okay. That's the issue.
Is the department looked at, or have you been able to determine whether in that medical assistance area there was provider misbillings, inappropriate billings, and if so, have you been able to estimate whether there would be savings from provider, whether you want to call them errors or abuses? I guess it depends upon the magnitude.
Well, we've just begun, we do know that we do have provider issues. We've just begun our statewide audit with 50 providers that we've flagged in the system. We're moving to 1,000 more this summer. And that audit will continue over the next, 24 months in an expeditious manner, so that we really can focus and take a look at the providers, where they've been flagged, if there's been any behavior that would warrant them being audited. So we're moving very quickly on that, understanding that we need to save every dollar possible.
Now, what would cause somebody to be flagged by the department? It
may be an overabundance of billing in one area. So somebody may, I'll just give an example, maybe a dentist that has 30,000 hits in one area, on, I don't know, dentures or something like that in a given time, in a short time frame. So we may start flagging those types of cases.
Okay, and the intent is to actually look at 1,000?
The intent is to start with 50 and this summer move to 1,000 providers across the Commonwealth. As you know, we've got, probably close to 100,000 providers. So what we're trying to do is take that top 10% and really get to that top 10% to ensure that, and in the future, I think it'll be a deterrent from providers if they know that we're really doing this on an ongoing basis.